I'm Dr. Fran Rowe, and I'm one of the veterinary nutritionists here at MedBarn. Today, I'm going to be discussing a topic our team gets lots of questions about, anemia, and specifically when nutrition and diet may be playing a role. So firstly, I always like to remind horse owners that anemia is a symptom of some sort of disease process. So when it's diagnosed, we have to do some further investigation to figure out what the underlying cause is. But before we jump into anemia and diet, it's important to understand what anemia actually means and why it's important. So we'll start off with a few basics. Anemia is defined as a decrease in the red blood cell mass. Red blood cells are one of the cell types found circulating in the blood, and their main job is to provide oxygen to the tissues. As these cells circulate, they pick up oxygen in the lungs, they carry it to every location throughout the body, and when they reach the tissues, oxygen is exchanged with carbon dioxide, a waste product, and the red blood cells then transport CO2 back to the lungs where we breathe it out. At the most basic level, tissues that don't get enough oxygen cannot function properly, and those tissue cells can actually die if they're deprived of oxygen for long enough. This is why it's so important for our bodies and our horses' bodies to maintain an appropriate red blood cell mass so that we can properly oxygenate the tissues and stay alive. So, red blood cell production. Red blood cells are produced in the bone marrow in a process called erythropoiesis. Erythropoiesis is largely controlled by the kidneys, which secrete a hormone called erythropoietin to stimulate bone marrow to increase the production of red blood cells. When the kidneys detect a reduced oxygen carrying capacity in the blood, they secrete EPO in response. Once new red blood cells are released by the bone marrow and the oxygen carrying capacity is back to normal, the kidneys decrease EPO secretion back to baseline levels. Okay, so now that we've covered the basics of red blood cells, what does anemia actually look like in horses? Well, there are many different causes of anemia, including blood loss or hemorrhage, red blood cell destruction, also called hemolysis, or decreased red blood cell production in the bone marrow. How anemia presents in the horse will depend on the underlying cause and its severity. So not surprisingly, there's quite a wide range of clinical signs possible. In some cases, horses show no clinical signs at all. This is because animals have a really remarkable ability to compensate for mild and even moderate anemias. Otherwise, signs may include lethargy, poor performance, poor coat quality, poor growth in young horses, pale or yellow mucous membranes if you look at the gums, and elevated heart and respiratory rates. In severe and acute cases of anemia, animals may progress quickly into signs of hypovolemic shock or even death. So if we think a horse might be suffering from anemia, what tools do we have to measure this? Generally, we're interested in measuring the number of red blood cells in the sample, as well as looking at the appearance of those cells under the microscope. With automated machines, we can also get a number of other red blood cell indices as listed here. I'm not going to go through all of these individually, but it just gives you an idea of how much information we can get about the red blood cells in a given sample. For anemia specifically, we're looking at either hematocrit or packed cell volume, depending on the method of measurement. And also for microscopic exam, we're interested in the size of those red blood cells, their shape, and potentially any identifiable abnormalities. So I already mentioned anemia is defined as a decrease in red blood cell mass. The opposite would be termed hemoconcentration, which is a topic for a different day. In adult horses, a normal packed cell volume, or PCV, is anywhere from 37 to 42%, depending on the source that you read. In nursing foals, it's a little less at 33 to 40%. And then as you can see, we can roughly break down the degree of anemia ranging from slight all the way to very severe, depending on our blood work results. And this just helps us describe the severity of that particular case. Okay, so once we've determined that an animal is anemic, we usually like to classify that anemia as either regenerative or non-regenerative. Regeneration just means, is the bone marrow responding appropriately to the anemia and trying to compensate? If the anemia is regenerative, then the answer is yes. Usually, regenerative anemias are due to hemorrhage or hemolysis. If the anemia is non-regenerative, then the answer is no. The bone marrow is not appropriately compensating, meaning the mechanism of this anemia is specifically reduced production from the bone marrow. Differentiating between regenerative and non-regenerative anemia helps us, the veterinarian, narrow down the underlying cause and reach a diagnosis. To do this, generally, we're looking for immature red blood cells in the blood sample under the microscope. Under normal circumstances, the bone marrow doesn't release immature red blood cells, but when production is ramped up, some immature cells may accidentally be released, and this tells us that the bone marrow is indeed responding appropriately to that anemia. However, plot twist, horses don't, or at least very rarely, release these immature red blood cells into circulation. We can make some assumptions about regeneration based on a few of our other red blood cell indices from our blood work, but this classification is essentially not applicable for equine vets to use. So then you might be asking, well, now what? Since we don't have regeneration to help narrow down the root cause of the anemia, we have to use our exam and the entirety of our workup to put together the pieces of the puzzle. Ultimately, we're trying to decide if the root cause of the anemia is hemorrhage, hemolysis, or reduced production in the bone marrow. And many times the answer isn't obvious. Okay, so now that we have a basic understanding of anemia, we can now circle back to the original topic for today. When are nutrition or diet and anemia related? Well, there are many different causes of anemia, and I would say most are not going to be related to nutrition. I've listed some examples here, but scenarios like blood loss from wounds or trauma, infections that cause hemolysis, or primary bone marrow cancers are not going to be nutrition related. The most common cause of anemia in horses, and most likely other animals as well, is called anemia of chronic disease. And this is when chronic disease states like chronic kidney disease, chronic liver disease, or chronic metabolic disease like PPID result in a mild secondary anemia. So, what are some examples of when anemia and diet are interrelated in horses? Well, for blood loss, we have bleeding gastric or bleeding GI ulcers. We know that dietary management can reduce the risk of ulcers and better support a healthy digestive tract. For hemolysis, we have toxins like garlic or onion, or copper poisoning, though this is uncommon. For reduced production in the bone marrow, we have those chronic disease states like liver or kidney disease, for which dietary changes can help manage these horses, though not necessarily reverse the disease process. There's also starvation, or horses that are severely underweight. as well as copper deficiency and iron deficiency. You'll notice that there are asterisks next to iron deficiency, and this is because I wanted to finish today's presentation with a bit more information on this topic specifically. We get asked a lot about iron deficiency in horses, but the truth is that true iron deficiency anemia is very uncommon. There have been a few case studies documenting iron deficiency anemia in foals, but nonetheless, it's a rare cause of anemia in horses as opposed to other species, including humans, where you hear about it a lot more often. And this is because horses have a really remarkable capacity for absorbing iron from their diet. When we consider blood work, the iron levels reported on routine blood work, this would be like a biochemistry profile, are not accurate, as they're influenced by external factors like feedstuffs in the diet or how recently that horse ate a meal in relation to having its blood drawn. To definitively diagnose iron deficiency anemia in the horse, different blood work is going to be required. Okay, you guys. Well, I hope that you found this presentation helpful. Here are a few key takeaways to remember when thinking about anemia and our equine friends. For those causes of anemia that are related to nutrition, you can do the following. Feed a diet that's appropriate for addressing an underlying issue, such as if your horse has gastric ulcers, kidney disease, metabolic disease, etc. You can avoid feeding garlic or onion or plants within this family. You can ensure that your horse is maintaining an ideal body condition, and you can ensure balanced vitamin and mineral intake. All right, here are references for today, and thanks for listening. Come check us out at madbarn.com or madbarn.ca if you have diet questions. We're always happy to help. Until next time.